Now, I'm gonna put this disclaimer out there. If you go to a pelvic floor therapist, the therapist is gonna go in whatever direction that they feel is most beneficial to you and then test those things. So just keep it in mind. This is a general overview of what an exam may look like so you feel comfortable walking into the office. Hi everyone, and welcome back to Stuff Moms Have Time For. My name is Rebecca, and for the next few weeks I am doing a pelvic health series for women, especially for moms. If you have not seen the first pelvic video that I have done in this series, I will put a link in the description below so you can check that out. But today's video is all about what to expect when walking into a pelvic floor evaluation. Nobody likes to be blindsided. Nobody likes to walk into a situation where they feel like they're gonna be uncomfortable. So my goal today is to be 100% transparent about what goes on during a physical therapy evaluation of your pelvic floor and why we do those things. Now, keep in mind, if there is anything that you feel uncomfortable with, every single physical therapist obtains consent before they treat you. So if you do not want to participate in something or do not want to do something, you will always be asked before any procedures are performed. You have the right to say no. Many of the tests that are being done are directly to benefit you, however, so keep that in mind when you make your decisions about whether or not you want to participate in certain parts of the evaluation. Be your own advocate, like I said in the last video. It is totally your body and up to you. All right, so the first thing that usually happens during an exam is you're introduced to your therapist. And then your therapist is inevitably going to ask you, why are you here? What is the reason that you chose to come to pelvic floor rehab? And what are your ultimate goals? What would you like to get out of it? So it's almost a good thing to have those kind of things in your mind before you go. What are your goals? Is your goal to go to the gym and no longer wear a pad? Is your goal to be able to confidently walk around and know if somebody makes you laugh, you're not gonna have a problem? Are those your goals? They will also ask you about your birth history. How many children have you had? How have you had those children? Cesarean, vaginal birth? Were you pushing a lot before you had a cesarean? Did you have an episiotomy? Did you have any additional procedures during that birth? They will ask you a lot about that. Then they're probably going to ask you a lot about your bladder and bowel health. So the first majority part of that evaluation is going to have the therapist getting to know you and your habits and kind of what is going on in your everyday life, because that's going to allow them to identify if you have incontinence, what kind of incontinence it is, what kind of exercises they can give you to best suit it. A lot of times people don't know all of the answers when they first go in, so that initial evaluation, the therapist may give you some homework, like keep note of when this happens or when this happens, to give yourself a better idea of what, when A happens, then B happens. You'll be better able to understand when you're having issues and exactly maybe link a cause to why you're having those issues. Then when it comes to the actual exam, the first thing they will do is establish consent. Are you okay with having both an external and an internal exam? Now, it's very different than a gynecological exam where they're doing a speculum or they're just observing or taking tissues for a pap smear test. This exam is basically testing and assessing all of the muscles in your pelvic floor. So an external exam will be done with palpation over all of the superficial muscles of your pelvic floor to see if anything is what we call hypertonic, where it's just working overload or having trigger points in it, leading sometimes to pelvic pain. And they're looking for symmetry. Are your muscles contracting together properly? Is one side working harder than the other? Then, with your consent again, they will do an internal exam. Now, there are 3 layers of muscles to the pelvic floor, so they will assess and palpate each of those layers and each of those muscles on both the right and the left side. They're looking for symmetry once again, comparing one side to the other. Is one side very painful and tender? They might have to do manual trigger point releases, just like you would if you had a stressed muscle somewhere else in your body. Once they've done all the palpation and decide what muscles are tight, what muscles are problematic, they will also do a strength assessment. Now, this is kind of where that Kegel component comes in. Normally, if you're told to do Kegels, you just, a lot of times people say, stop yourself from peeing, and that's like a Kegel. But really what they're asking you to do is almost take your tailbone up into your pubic bone and try to lift everything up as much as you can without holding your breath and without using any extra muscles. So what they'll usually do is they're gonna take an assessment of power. So how strong and how much of a lift do you actually have? Your endurance, how long can you actually hold it? And then how many reps of that endurance contraction can you maintain? And then how many reps of a Kegel can you do quickly at the same intensity that you started the first one at? So they're looking for all of that, and that's how they use their muscle testing system. That is going to be your baseline, and then they're going to prescribe you an exercise program based on how you do that baseline. Once you do that, in a few weeks or a few sessions, they're gonna go back and they're gonna reevaluate that and see if your strength scores are better than before. So that is why they have it as an objective measure. Are you really doing better? When they do the internal exam, they also usually test for prolapse. If there is time during your evaluation, your therapist may also do something called biofeedback. Now they can do this two different ways. They can use electrodes, which they put on your perineum, which is basically the external part of your pelvic floor, or they can use an internal probe, which basically looks like a tampon, and there is no information going to your pelvic floor. You're not gonna get shocked. It's only information that's going from those electrodes to the computer to basically get an idea of what your pelvic floor is doing when it's resting, what your pelvic floor is doing when it's contracting. And they may ask you to do a series of tests. They may ask you to do 10 quick contractions. They may ask you to do longer duration contractions and see how well you can do. This is also kind of a good guideline to see a baseline, to see in a few weeks if you can outperform the way you performed before. It's also a really good tool to visualize, am I doing a contraction properly, and how long am I holding it, and when am I actually losing it when I think I'm still doing a good job. So the biofeedback is basically a visual representation of what you're doing to allow you to do it better. So your therapist may also use this tool with you. Usually at the end of a session, your therapist will wrap up everything that they've done as far as what are your strengths, what are your weaknesses, what muscles that they found to be hypertonic, what kind of things that they're going to work on with you, and what homework they're gonna give you. Yes, there's homework. If you're in physical therapy right now, do your homework. Your therapist knows when you don't. So they will give you exercises to do based on the testing results. And then a lot of times when you come back in, sometimes it's weekly, sometimes it's bi-weekly, sometimes it's every 2 weeks, depending on what you need and what you can do. And a lot of times they will use the biofeedback in their office to show you what to do, to show you how to do a contraction. And sometimes what they'll do is they'll even give you different cues to do a contraction, and then they'll see which cue works best for you, and then that's the cue you use at home to do your Kegel contractions. So to wrap up, basically what an evaluation will consist of is a history, both your personal physical history as well as your birthing history, what type of issues you're having, what are your goals, an external exam, an internal exam, a strength exam, and sometimes a biofeedback exam to make sure that you're doing everything right. Then they will assign you homework based on that entire examination and probably schedule another appointment. I hope you found this video useful. If you would like to stick around, I would love for you guys to subscribe. I do wellness, DIY, cocktail, and recipe videos weekly. Please hit the notification bell as well so you'll always know when I upload new content. I hope you guys enjoy this video and that it's alleviated any fear that you may have about going to see a practitioner, and also gave you insight into what will happen during an evaluation. I will see you guys next time.